You're still now seeing the PPT, right?
Yes, miss.
Okay. So last class we were doing about the air pollution, the outside air pollution, the indoor air pollution, and then we stopped with this portion where we need to use the disinfection methods whenever there is a gathering of a large number of people. We saw what is happening before, after, and also the during. And now we go into the proper disinfection. What is disinfection? What are the different techniques and also the chemicals that has been used? So we start with disinfection, a bit of its history. So Semmelweis is considered as the pioneer of disinfection. We could say like that. He was the person who demonstrated the value of hand washing with an antiseptic solution. And the solution that he used was calcium hypochlorite or chlorinated lime when he obtained considerable reduction in the death rate from puerperal fever. Now, this story, the Semmelweis story, I'm very sure the seniors remember that. But Farah, I guess you wouldn't be knowing about anything about Semmelweis, or do you know? Have you heard about him already?
No, miss.
Okay, so Semmelweis, he was actually an Hungarian physician, and he was appointed as a physician in actually one of the hospital, the Vienna General Hospital. So this general hospital or that hospital, they had two maternity clinic. We can name it as maternity clinic A and B, and it was actually these clinics were, excuse me, were actually satellite clinics. It was not in the main hospital, but satellite clinics in two different areas for the same geographical location. So it used to work actually alternate days. So in this one, there was a very strange thing that was happening. The clinic number one or clinic A, they had a higher mortality rate, the maternal mortality rate. Many of the female or mothers who come there for delivery, they would be having this puerperal fever or the postpartum infection. After to delivery, they have some not antiseptic, some infection, and then most of them die. So the death rate of mothers over there in that clinic A was around 20 percentage, and in clinic B it was very less, like 4 percentage. So even the physicians inside the hospital were not they were not sure why it is happening so, but that was the condition. And even this mortality rate, or not the technical term mortality rate, even the females outside, they also knew that this clinic A is so notorious. Many of the female or mothers who go to give birth in that clinic will be dying, so they preferred actually to go to the second clinic only. And sometimes it was told that when we see the history, the females rather preferred to give birth in the street than to go to the clinic one. So if they are supposed to come, like because it works on alternate days, the mothers used to request that they need to get appointed only on the clinic B. They don't want to get appointed to the clinic A. But at that time, the public health measures was such a thing that to get some benefits, the financial benefits, they had to have the institutional delivery. So these mothers were supposed to go to institutional delivery, and then only they will get some financial benefits. But they didn't want to go to clinic number one, so what they used to do is they would wait for a longer time to get appointed. And when the time comes, or when they feel the pain, they wait until the last moment. Maybe if it is a clinic A that is functioning that day, they know already. So they will be waiting until the last moment that they will be coming out of their house only when it is almost time to give birth. So they give birth most of the times on the street rather than reaching the hospital. So only if they reach the hospital, they have to get admitted to clinic one in case that day it is the clinic one that is functioning. So what they used to do is do like this, to give birth on the street. And why they used to give birth on the street is Then at that time, they could show that they were on the way to the hospital, but they couldn't reach up to the hospital even before that delivery happened. So still, even though it is not a institutional delivery per se, because they were traveling or because they were walking or whatever to the clinic, so it showed that their intention of institutional delivery. So they felt like okay, they would be getting the financial benefits, and also mothers are also relieved that they are not admitted in the clinic one. So this was the scenario that was going in that Vienna region when Semmelweis joined, and he wanted to find out why this maternal mortality rate in clinic 1 is this much high. And then he wanted to find out what is common and what is difference in both the clinics, and the delivery techniques are both in both the clinics were almost the same. Then he thought it may be some other factors like overcrowding, too much people coming up. But this overcrowding was always in clinic B because most of the women wanted to deliver in clinic B. They didn't want to go in clinic A. So overcrowding, if overcrowding is the reason for the infection, then the mortality rate should be high in clinic B. But that was not happening. It was in the clinic A, which was not overcrowded. The mortality rate was high. Then he thought it might be due to some climate variation, but that also was not possible because there were satellite clinics, as I told you, but almost in the same geographical area. It was not so widely placed. So he understood it is not the climate also. And then he was trying to find out some other reasons, and he tried to change the position of mothers when they give delivery, but nothing made any characteristic change. And then he noticed that the only difference between clinic A and clinic B is actually the people who are working there or who are conducting the deliveries. The clinic A is being conducted. When we see high maternal mortality rate, we suppose that that will be conducted by some less experienced or less sophisticated people, but that was not the situation. Clinic A was actually conducted or run by physicians or the surgeons, actually, the doctors, actually. And Clinic B, it was run by midwives. So he could find out only that difference between both the clinics. Nothing else he could find as a common reason for this. And then he began to notice this two group of people, the differences, anything that they are doing, the process or whatever. And before he found out, oh, what led to his finding why this maternal mortality is happening, because during his working over there, like he joined in 1846, I guess, and it was in 1847. 1 year later, he was able to find out what was the reason. So in 1846, uh, one second. So it took nearly 1 year for him to find out what exactly the reason was. So that time while he was studying, what happened was one of his friend happened to pass away. And that happened due to septic injury itself. Some sepsis has happened. And this sepsis or septic injury he got because of a accidental scalpel injury from a medical student. So a medical student accidentally from his scalpel, one of his friend, Semmelweis friend, got infected, and that guy passed away because of this infection. And when his postmortem was done, his body showed some pathology which was very similar to the pathology or the postmortem pathology of the women who passed away due to puerperal fever were having. So the pathology showed by this person and that group of women who died because of this septic fever or the puerperal fever, both of their pathology, the postmortem pathology was similar. And this made Semmelweis think like it is due to the people who are doing this glue because the pathology being same, the scalpel injury. So something is with the people who are running this clinic. It's is the problem for the maternal mortality. And then when he started observing, he noticed that when these doctors they are coming to the clinic A, Usually, because they are doctors, they will be attending the surgery or the postmortem before to that. From before morning or something, they will be doing this postmortem or whatever something related to that surgical things, and then they directly come to clinic A, and they do that, and they don't do this washing, the hand washing or with a disinfectant or an antiseptic solution. They don't never used to do it until that time, until when Semmelweis asked them to do. So because they were doing this postmortem, and then with those infected hand itself, they were coming to the clinic. They were transmitting actually the organisms, which resulted in the high puerperal fever. And in the second clinic, because it was run by midwives, they didn't have to go to this surgical operations or the postmortem rooms. They didn't have to go. They were directly coming to the clinic B. So they didn't have any infections carried by them. So that was the reason why there was no or very less infection that was happening in clinic B. And when Semmelweis discovered this is the reason, there is no proper hand washing, then he asked all the doctors who were coming from the surgical room or the postmortem room, before going to the clinic A, they should do this washing with that antiseptic solution, which is calcium hypochlorite or chlorinated lime. There was considerable reduction in the death rate, and it is told that actually before hand washing it was about 18.3 percentage, and just after 2 months the maternal mortality rate in the clinic A, it reduced to 1.9 percentage. So almost a 90 percentage reduction. So this hand washing, now you know during the COVID time, how WHO had introduced hand washing. There should be minimum timing. And also there is a different process, and most of us don't follow that typical process of hand washing. But that was pioneered by Semmelweis, and that was his experiment, which happened in Vienna General Hospital. The second person, who is also a pioneer, we can say he was the pioneer of antiseptic surgery. That was Joseph Lister. He was actually a microbiologist also a physician, and he reduced the number of wound infections by prophylactic application of an antiseptic, and he used carbolic acid or phenol to wounds. So on the wounds he used that, so that the wounds didn't go into a septic stage. So these are the two important people, whenever we have, I mean, we have to remember whenever we deal with disinfection: Semmelweis and also Joseph Lister. That why do we use these antiseptics or disinfectants? The purpose, we can say, one is to control the communicable diseases. We don't want the disease to get transmitted, so whatever we use, we clean it, we sterilize it. Then to sterilize the sophisticated instruments, especially the medical instruments, so for its sterilization, and also for the treatment of fungal and bacterial infections that is happening on the skin and mucous membrane. So why we use this? To control the disease, to treat all the wound that is happening in our skin or mucous membrane, so that more bacteria or fungi doesn't make that wound more worse, and also for the sterilization of the materials, instruments. It can be medical instruments or the things that has been used by a patient who is having a communicable disease. So that's the purpose of antiseptic and disinfectants. So this is Semmelweis and Lister. And while I was Googling Semmelweis photo, I happened to come to this picture in Google, and I got to see that a movie was released based on Semmelweis, the person itself, because I just, not the movie, I just went to see the plot. So it was actually based on this instance itself, which I told you, the Vienna General Hospital. So this was a movie, I think it released in the year 1952, but now again in 2023 they re-released. I don't know where you can watch it, but I just saw it is available. So if a link is available, you can see. So now we go into the definition of disinfection, and so some common terms. Now, before I start this topic, um, now because the term itself you will understand it is disinfection, disinfectants, antiseptics. So it is completely so many concepts, some theories, not concept and theories per se. It is certain things which are we use as a chemical disinfectant. So for what are the purposes, what are the disadvantages, what can we use for a particular technique, what we cannot use for a particular technique. That's all in this section. There is nothing much I can add into it because it is more of I mean, a dry topic, by hearting or a mugging up topic. Even I wanted to reduce the content actually to reduce it, but then I thought at least in our house, whenever we need a disinfection in our house, we can use this for our knowledge. So that's why I kept in the full actually. So there is nothing much for me to explain in this. So that will be a rather boring session actually. Let's see. So we have the two terms whenever we say about disinfection. One is disinfection and other is sterilization. So what are the difference? There is only one difference between both the process, though there is a very large sentence indicating its definition. The major difference between disinfection and sterilization is the organism that is being getting killed. So in case of disinfection, almost all the microbial organisms can be killed, but not the bacterial spores. Now, from the knowledge of your microbiology, you already know the bacterial spores. They're very resistant. They actually have a very thick coat surrounding their body, and that will help them to survive most of the adverse situation. Even if it is too dry, too high temperature, there is no food because of their coat, the sporing coat around this spores, the bacterial spores, they are difficult to be destroyed. So in this infection, we are not able to destroy those bacterial spores. But in the process of sterilization, it does sterile. It will kill all the organisms, even including the spores. So that is the main difference between disinfection and sterilization. The whole sentence, the whole definition, it doesn't matter. The main characteristic difference is in disinfection we can't kill the spores, and in sterilization we can kill the spores even. So now keeping that point, we'll just go through the sentence or the definition. So disinfection is a process that eliminates many or all pathogenic microorganisms but except the bacterial spores, and it is also used on inanimate objects. In healthcare settings, objects usually are disinfected by liquid chemicals or by pasteurization or wet pasteurization. In case of sterilization, it is a process that destroys or eliminates all forms of microbial life, which even include the spores also. And in the healthcare facilities, it is the process of sterilization can be carried out by physical or chemical methods. What are those methods? The physical methods and chemical methods we'll be seeing in the coming up slides. So anyway, some of the examples given over here is the steam which is under pressure, dry heat, ETO or ethylene oxide gas, hydrogen peroxide, and liquid chemicals are the main sterilizing agents which are used in the healthcare facilities. Then there is term sidal and static, but before to that, we'll go to the next slide. The antimicrobial agent. So antimicrobial agent, the word itself, you will understand, it is against the microbe. So this is an umbrella term. It is an agent that can kill the microorganism. So then we call it as microbicide or side, which means killing, or it can stop their growth, and then it is called as bacteriostatic agent. Now going back to the previous slide, you can see I use the suffix that is sidal, and sidal, which means it's a suffix which means that it kills, like bactericidal, fungicidal, or even when we come to other terms, suicidal, homicidal, which means the killing. So bactericidal is an agent that kills bacteria, and static, it means to make something stationary. It is not killing, or it is just making it stationary or static or stop over the. So Technically, what it means is it's an agent which inhibit the growth. They're not killing, but they are inhibiting the growth of that bacteria. The bacterial reproduction, it doesn't happen. That is what a static agent means. So fungistatic, which means an agent which can inhibit the growth of fungus. It is not killing the fungus, but it is inhibiting the growth of fungus. And both these things, the sidal and the static, it's coming under the antimicrobial agent. So the agent that kills a microorganism is called as microbiocide and or stops their growth. It is called as bacteriostatic agent. And these antimicrobial medicines, it can be grouped according to the microorganism they act primarily against, like antibacterial, antiviral, antifungal. According to the organism on which it is acting against, we term it like that. The main classes of antimicrobial agents are disinfectants, antiseptics, and antibiotics. So disinfectants, we already saw that it is going to kill a wide range of microbes, but not the spores, and especially it is used on non-living surfaces. Now antiseptics, these are also killing a large range of microbes, but it is applied to living tissue. It is not like an inanimate or non-living, but antiseptics, which we use, like when we have a wound, we use either Dettol, Savlon, or whatever antiseptic, and we are using it on a living tissue. So that is antiseptic. But whenever we have a injury, we are not going to use uh, the floor mopping Lysol and all. We will be having phenyl, Lysol, etc. in our home to clean or to mop on the floors, and we are never going to use it on our wounds actually. In a lower concentration, of course, we can, but still we won't be using, because disinfectants are mainly meant for non-living surfaces and antiseptics are meant for the living tissues. The third one is antibiotic, and antibiotic is something that is to be taken inside. It destroys the microorganisms within the body. Now, disinfectant or the germicide, what we already told, it destroy the harmful microbes but not the spores, with the objective of preventing transmission of disease. And it's suitable only to be applied on inanimate objects. So antiseptic, which we saw earlier, it destroys or inhibits the growth of microorganism and always used on living tissues. A disinfectant in a lower concentration can act as an antiseptic. But the difference between antiseptic and disinfectant is mainly used on inanimate objects and antiseptic which is used on living tissues. The difference between disinfection and sterilization is disinfection can kill almost all the microbes but not the bacterial spores. And in case of sterilization, it will kill all the organism, including the spores. Then there are other things like deodorants and sanitizer. Now, deodorants don't consider this as our body deodorant, but this is especially the meaning, the definition, both are same, but still the examples that is being used. So, in case of deodorant, it is something that is going to neutralize a bad smell or going to suppress it. But over here, because we are discussing about the healthcare facilities deodorant, we are not mentioning about the deodorant that is being used as a accessory. But this is more about the deodorants that we use in a hospital care setting. So that the example will be lime and bleaching powder. So for example, a patient who has vomited and the room is very much bad smelling, then of course we are going to use some liquid, the lime, the bleaching powder, something we are going to use to neutralize that. So deodorants in that aspect, the hospital care facilities, that's what we are explaining here. Then sanitizer. During COVID, what we used to use and even now. So it reduces the microbial population to safe level. So it is not killing the organisms. It is not stopping or inhibiting its growth. It is just reducing that microbial population to a safer level. So that's the by definition sanitizer is. Now, what are the properties of an ideal disinfectant? To call it as a perfect or an ideal disinfectant? What are the properties? So there are many properties, like about 12 properties it should have. However, when we use the term ideal, you will understand that it is very difficult to achieve that ideal state and all. So to be called as an ideal disinfectant, it should be 12 that is present. But nowhere it will be, I mean, all the disinfectant that is present or now available, it won't be having all the 12 features. A few will be there, then another disinfectant will be there, which will be having some other features. So, but in total, all these features, if they have, it is called as an ideal disinfectant. So this one you can expect as a short note question or a 5 mark question. So the first property of an ideal disinfectant is it should be broad spectrum. And you would be from microbiology will be knowing what is broad spectrum. Even the antibiotics, sometimes it is not our language, but mostly in the allopathic treatment, they use the term that broad spectrum, which means it should be able to kill a large number of microorganisms. It shouldn't be specific, only one type of organism. It shouldn't be, because then we need to have separate disinfectant for each organism. So it should be broad spectrum, a large number of microorganisms we should be able to kill or to destroy with this disinfectant. So the first one should be a broad spectrum. It should have wide antimicrobial spectrum. Large number of microorganisms we should be able to kill with that. It should be fast acting, though it should produce a rapid kill. When we are using a disinfection, we are not expecting, okay, this is going to act 3 or 4 days later. That's not what we want. We want that the killing action to happen immediately, not 3 or 4 days later. So this is another criteria. It should be very fast acting one. Third one, it should not be affected by environmental factors. Environmental factors like sometimes the temperature can also be included in that. There are certain chemicals, especially the bleaching powder. If you are going to keep it for a longer time in external temperature, the chlorine will be getting disintegrated, or it will be getting evaporated. Its quality will be affected. So those external factors shouldn't be affected. This chemical that we are using or the disinfectant, to be called as an ideal one, it shouldn't be affected by external factors. But there are disinfection, when we see that there are disinfectants which may or may not um, follow this criteria. That's why I told you it's always ideal one. Not everything is having every feature. So the first one is temperature. I told you humidity can be another factor. The thing over here is this disinfectant. It shouldn't be um, getting inactive in the presence of organic matter. Like when we are using, because in the healthcare facility we are using means this disinfectant is used whenever there is some blood, vomit, stool, sputum, everything is there. So, or everything or some of it is there, and we are using disinfectant to clean this place. And all these things, the blood, sputum, feces, they will be having some proteinaceous things, materials in that. Even the blood, all the physiological components in that. So there will be, and even if it is because we are saying about a patient, the sputum, the feces will be having that microorganism also, and this microorganism will be releasing certain toxins. So all these discharges will be having some or the other kind of proteinaceous or nitrogen based substances. So when a disinfectant is used, even disinfectant is also chemical in nature. There are physical disinfectant, yes, but mostly it is chemical also. In a less, what to say, the low and middle income countries will be usually going for the chemical, which is much less expensive. So when two chemicals are coming together, it shouldn't be that the disinfectant will be losing its disinfectant property. So that is one criteria. It should be active in the presence of organic matter. The organic matter, the nitrogenous waste products, in that presence, if we are using a disinfectant, and if the disinfectant is going to lose its property, disinfecting property, then there is no meaning in using it. So that is one thing. And it should also be compatible with soap, detergents, and other chemicals encountered in use. We are using a disinfectant, and if you are going to mix some soap or also detergent also into it, and then the activity will be lost, we don't want such a disinfectant, of course. Even when it is leave the hospital setting, when we come to our house and we need to clean it over there, if we know that there is some disinfectant and we can't use it with in combination with some detergent or soap, we need to have then other kind of disinfectant which we can mix it with, even to mop a floor. So that is another criteria. So all these external factors shouldn't affect the disinfectant property. Then it should be non-toxic, means it should not be harmful to the user. That's also another criteria. Um, Whenever we use, especially there are sprays that is available. I don't know over here in India we used to get, because we have a lot of mosquitoes over there. We do have some company which is called as HIT, and they do have, I mean, it's like a spray. We can use it generally or especially for mosquitoes. And whenever there is a bad smell, or even ants, against ants, and some small insects if it is coming over. So we use this heat over there, but it is having, it is not toxic. It's not that I'm going to respire it and at that moment itself I'm going to die. Nothing that happens, but it is a irritant actually because it's chemical. If it we are going to inhale, it can act as a irritant. Some people will be allergic to its smell. So it is not deadly toxic, but it is toxic. But ideally, so whenever we are using it, we use actually a mask, not the mask that is available now after to COVID, not the one. Tightly cover our nose and mouth also with this with a cloth, actually cotton cloth, and then apply this. And then we immediately close the room after applying, and then we open the room only after 30 minimum 30 minutes, so that the smell it remains there and we are not directly respiring. So and also any other chemical, it shouldn't be toxic to us, producing some other, we may be allergic, but it shouldn't be toxic. So that is another criteria. It shouldn't be toxic. Surface compatibility. It should not corrode the instruments and metallic surfaces. Imagine a disinfectant we are using on our house, and that is going to corrode some of the things. There are disinfectant we have to go through its labeling, have to find out what are the safe areas where we can use it and where we can't use it. Such labeling is very much necessary in case of disinfectant, but most of it, like, it shouldn't corrode generally the instruments and metallic surfaces, and it should not cause the deterioration of cloth, rubber, plastics, and other materials that will affect the purpose of it. Then it should be having residual effect. Residual means something that is a balance or remaining. So the same thing, um, when we are using it, we want it to have some action that is remaining for at least a few hours. Depends upon what is using and what is the purpose that is being used. So it should leave, whatever that disinfectant, it should leave an antimicrobial film on the treated surface. Like when we are mopping the floor, we are not expecting that it will be keeping the floor disinfected for a complete 1 week, 1 month. We are never expecting that, but at least for few hours, that disinfection should be working. The next day, because we may be mopping every day or sometimes just once a week. So there should be a residual action that is present at least for few hours or one day. We feel that okay, the organism is not going to flourish that easily. So the a residual effect should be there. It shouldn't be like we used it and in 1 minute everything is killed, but after 10 minutes the organisms is going to come up, then there is no meaning in doing that. So a residual effect should be there, and it should be easy to use with clear label directions. I told you how much important the labeling is in case of disinfection. It should also indicates it's very simple should be the where it can be used, where it can't be used, what should be the concentration on using, and so many directions they will be giving on the labeling, and we should follow those labeling details whenever we are using a disinfectant. then it should be odorless. It should either have a pleasant odor or no odor. That's why I told you when I told you the example of heat, it is a pungent smelling or quite an irritant. So I can't say it is of a pleasant odor or no odor at all. It is having quite an irritant odor. And almost all the chemical agents what we use, the disinfectants, whatever there is in your house, it leaves some vapor, some smell is coming out. So that's why I told you not all the disinfectants are having all the features. There are things that might be having, there are things which are not having. So ideally, the disinfectant, an ideal disinfectant, it should be either having a pleasant odor or no odor at all. It should be economical. It shouldn't be too expensive. Solubility, it should be soluble in water. That is how we can use the mopping. We can't directly put the liquid on the floor unless the labeling says so. So it should be soluble in water. There should be some stability, be it in concentrate form or in the dilute form. It shouldn't be getting instabilized because it is a chemical agent. It shouldn't be getting instabilized in the presence of water. Be it concentrate or be it dilution, it should be working. Then last but not the least, environmentally friendly. It should not damage the environment and on disposal. But this one is another thing which we cannot guarantee because all the chemical disinfection is having some chemical things. It is against the microorganisms. So this is going to create some other problem when we are going to dispose. So how much disinfectant are available in the environment which are completely environmentally friendly? I'm not sure. Only the degree varies. Everything is a danger, but only the degree may be varying. Some will be less dangerous, some will be more dangerous, but it is not that it is not dangerous at all. This next one is the types of disinfection. What are the different types of disinfection? So we have three types of disinfection: concurrent, terminal, and precurrent or prophylactic. So from the term itself, now you can guess what this may be saying about. So concurrent means concurrent, that is something happening simultaneously. So this should be the concurrent disinfection should be something that is happening simultaneously. The second one is terminal. Terminal means towards the end. So this disinfection should be happening towards the end. And the last one is precurrent. From the word precurrent, it is difficult to differentiate unless we connect it to the word concurrent. Or we can go for the second word, that is prophylactic, which means a preventive type of disinfection. So now we'll go in detail. From these terms, at least we can make a guessing. Okay, this might be the disinfection. So what is it in detail? We'll see. So concurrent disinfection, as I told, something that is happening simultaneously. So this is a disinfection that is happening whenever a person is discharging. Because we are again coming, we are sticking with the healthcare facility itself. Like a patient, a cholera patient, he is passing his stool. And then, if we are disinfecting that stool at that moment itself, not storing it for a long time and then disinfecting it, no. As soon as the patient is discharging that stool, we are immediately disinfecting it. That is actually called as concurrent disinfection. So, concurrent disinfection, it is the application of disinfective measures as soon as possible after the discharge of infectious material from the body of an infected person or after the soiling of articles with such infectious discharges. In other words, the disease agent is destroyed as soon as it is released from the body, and in this way, further spread of the agent is stopped. It can be also possible that the patient is made to pass the stool. The patient is not going to get up and sit in case of a cholera patient, but the stool is directly from his anal part. Some tube may be connected or something, or a pan is connected, that it is directly getting into a bucket in which already a disinfectant is used. So that is a type of concurrent disinfection. So concurrent disinfection consists of usually the disinfection of urine, feces, vomit, contaminated linen, clothes. hands, dressings, aprons, gloves, etc. throughout the course of an illness. Terminal disinfection, it is happening towards the end. And towards what end? We can see it is the application of disinfective measures after the patient has been removed from that area. So after the patient has been removed, it can be the patient removed by death. So called a patient is the he had isolated him. This is I'm just saying we shouldn't do like that, but just imagine. So we have isolated him. He's passing this tube because he is in isolation, and we are not getting into contact with him. So like that, when he had passed away, after that everything being removed, cleaned, etc. Or if the patient has been transferred to a hospital, then that room is cleaned, everything, or after the person has ceased to be a source of infection, after he cleared out the disease. But however, this is now scarcely practiced. Only maybe we may be using not in the hospitals, but maybe in the case of some in home, whenever there is a bedridden patient. But even in his case, also there may be alternate days cleaning and all. But sometimes, if the family is so poor and they may not be available, they might have isolated the patient and kept in a corner room or something. And once he passed away or he is away from his sickness, then they take all the mattress, the linen that have been used by him, and then cleaning it. But anyway, this is now scarcely practiced. The terminal cleaning is considered adequate if we are going to do even the rooms. We are going for a airing, sunning of the rooms, and also the furniture and bedding. So not just that we use some chemicals in that room, but we take out all the things that has been used by the patient, the furniture, the bedding, everything, and keep it in the sun. That's what meant by sunning of rooms, or even opening the windows so that the sun and the air can get inside. So even because the sun and air are considered as natural disinfecting agents, even we once a while we will be keeping all our mattresses outside in the sun to get it or kill the microbial organisms. So this terminal cleaning is considered adequate when we not just clean the room with some chemical disinfectants, but all the things used by the patient, the furniture, the bedding, and even the room itself open for aeration and also the entry of the sun rays. The last one is the pre-current or the prophylactic. So something that is we are doing to prevent the development of the infection or a kind of disinfection which is happening prior. So the best example will be pasteurization. When we do the pasteurization of milk, which is actually we are killing the organisms prior to what it causes the disease, or even disinfection of water by chlorine. That is also an example of prophylactic disinfection. The natural disinfectants, just in the previous slide I told you, it is mainly the sunlight and air. So direct and continuous exposure to sunlight is destructive to many disease-producing agents. The ultraviolet rays can actually be very lethal to bacteria and some of the viruses. So all the articles that has been used by the patient, like linen, bedding, furniture, may be disinfected by exposing to direct sunlight for several hours. The second one is, which is a natural disinfectant, that is air, exposing to open air. So it will cause the drying or the evaporation of the moisture. And when you learned microbiology, you might have learned that most of the microorganism, which is actually causing disease to human being, they require humidity because they are able to survive in an atmosphere in which a human being can survive. That is how they are going to infect us. If there are bacteria which are cryophilic, or which means they can thrive only in very cold temperature or freezing temperature. If that bacteria is going to come inside our body, it is naturally going to die. We don't have to do anything because at our body temperature of 37 degrees Celsius, that cryophylic bacteria, which need a freezing point temperature, it is going to die out. Likewise, there are temperature, there is the thermophilic, which are bacteria which are surviving in a very high temperature, like above 70 or 80 degrees Celsius. When it is coming to our body, then also it can't survive. So we need, or the bacteria, not we need, the bacteria or any other organisms which are able to infect human beings, they're actually able to survive in the atmosphere where a human being can survive. So for our survival, we have seen that we need a minimum level of humidity, not the maximum, not the minimum. So if there is air when we are doing the aeration, so even for the existence of that particular bacteria, it need a particular level of humidity. So and some of the bacteria, they take their nutrition by this humidity. They need that humidity for their existence. They can't exist in a dry atmosphere. So whenever it is being exposed to the external airing, because of drying or evaporation of moisture, this can act as very much lethal to most of the bacteria. However, these agents, that is sunlight and air, we can't trust them always. They will be fluctuating in nature, so we can't depend on them totally for disinfection. So for that, we have other two methods, the physical disinfectants and also chemical disinfectant. So we start with the physical disinfectant or physical agents of disinfection. The first one, the first ideal thing is burning. Whenever we have some soiled cloth over here, I don't know if you do have some space, your own house and some courtyard, probably you may go for a burning because that's the most ideal and the excellent method. So burning or incineration is an excellent method of disinfection. Inexpensive articles such as contaminated dressings, rags, swabs can be disposed of by burning. And if we are going to add certain things like sawdust, paper, kerosene, and other combustible material, it will be adding up that burning process. Even feces, the contaminated feces, if it is in a small quantity, it can be disposed of by burning. But burning, however, it should not be done in open air because when we are using, if we are going to burn out some toxic materials like the feces and all, it is going to release certain toxic fumes which will be remaining in the earth atmosphere, which will be causing some other problems. So burning ideally should not be done in open air. It is best to be done in an incinerator. The second method, the physical method, is actually hot air. And hot air, we use this hot air in actually a hot air oven. And this you have seen in the lab actually, the hot air oven. So this is a very useful method that is used for sterilizing, not the word sterilizing. So we are going to use it for sterilizing the articles, especially that is being used in the hospital level, the glassware, the syringes, swabs, dressing, oil, Vaseline, and sharp instruments. So according to those things, the temperature will be set. If it is oil or Vaseline, the temperature will be set in such a manner and it will be done in the hot air oven because we cannot burn or do burning for the glassware or syringes. We can't even use that. So the another method will be the use of ovens. The drawback of hot air oven is that it has no penetrating power and is therefore not suitable for disinfection of bulky articles such as mattresses. That is one of the drawback. It is not penetrating inside. The hot air sterilization is usually done in hot air oven. The temperature should be maintained at 160 to 180 degrees Celsius for at least 1 hour to kill the spores. To kill the spores, see the high temperature and also minimum time of 1 hour. Minimum temperature of, I mean, minimum time of 1 hour to kill the spores. Unfortunately, such elevated temperature destroy plastic, rubber, and other delicate substances. So here from this, sometimes the MCQs may be formulated like can be a 5 mark question, or sometimes it may be like plastics cannot be disinfected by this method, and then giving you some options. So like that, it can be formulated the questions. This is a incinerator, industrial or factory, what we see in a large scale. Incinerators at home based for a small scale use also we can nowadays get in the market. And this is the hot air oven, which you might have already seen in the microbiology lab. The third method is boiling. That's an effective method of disinfection. Boiling for 5 to 10 minutes will kill bacteria, but not, but still not spores or viruses. And boiling for 5 to 10 minutes, it's actually rolling boil. And rolling boil, I hope you know that, which means the boiling has happened. We consider the water has boiled when the bubbles are coming from down to the superficial area. That's when we actually switch off, if we are boiling the water on the gas stove or the electric stove, when the bubbles are coming out. Actually, from that is considered as the boiling point. But from then, we continue that boiling process to 5 to 10 minutes. That is actually called as the rolling boil, and that can kill bacteria, but not the spores or viruses, even then. So I remember when I was a small child, my mom will be asking me to switch off the water, which is kept for boiling, once it is getting boiled. So if I delay for 1 or 2 minutes, she'll be like, "Please off it, otherwise the cooking gas, it is going to be finished, or soon it will finish." And not just cooking gas, we are utilizing it more. Not only that, the second problem is if we are not attending, obviously, because if it is in full flame, definitely the water will be getting very easily evaporated, and even the utensil we are using, that can also get burnt if we are not attending, if we are keeping it for a rolling boil and then we are not over there. So I used to stand over there and then immediately off, the when the starting 2 or 3 bubbles start come from the underneath of the water towards the surface. Then itself I used to off it. And then when I entered the medical college, of course, we learned about the rolling boil and all. And because sometimes it is not useful to fight with mothers. Even when I knew the importance of rolling boiling, I never used to take class for her. I was like, okay, whatever happens. Until then, we none of in our family had any some very dangerous disease or something. So I was like, okay, let she follow her style. And whenever she says to off the gas, I just, if it is boiling water, I just off the gas. But during COVID, what happened was, she was not there in the kitchen, and when I went to take something, and I saw the water was getting boiled. So immediately I off the thing, and then I went to my mom's room. So she was doing something, and I told, "Do you remember you have kept that utensil for boiling the water?" And then she told, I remember, as if nothing has happened. And then I told, "Why you didn't say to me? At least I would have taken care to off it." No, no, no. It should be kept for a longer time. That's what the video says. So she started seeing YouTube videos. Thanks to YouTube and the release, sometimes it is so informative. And during the COVID time, they were always saying about the importance to keep the things hygiene. So she was saying it will kill all the microorganisms. We should keep it for 5 to 10 minutes. Then only all the microorganisms will be killed. And I was like, oh, thank God. If I have told her same thing, she wouldn't have been. She would be still saying, oh, no, no, what is the price of gas? Do you know that? And be saying like that. But some YouTube video teaches her. She has exactly learned that thing. And then I told her, okay, when you're keeping in a rolling boiling, you should be at least over there. Otherwise, the water will be getting evaporated and the utensil will get burnt actually. So, at least for that purpose, you should be there. I used to say. So, sometimes it is very informative. Still, even when we do the rolling boiling, it's not going to kill the spores or viruses. Boilers provide temperature well above 90 degrees Celsius, but to ensure the destruction of spores, the temperature above 100 degrees Celsius should be there, which cannot be achieved in boilers. Boiling is suitable for disinfection of small instruments, uh, tools which are not used for subcutaneous insertion, linen, and rubber goods such as gloves. Linen that is been stained with feces, pus, or blood should be first washed in cold water, preferably with a disinfectant such as 2.5% Cresol, and then subjected to boiling. With frequent stirring, because linen and clothes are poor conductors of heat. So we should be in between. This is a process that I used to see my grandmother, not my grandmother, but my grandmother would be supervising, but other people will be doing it. I have seen it in my childhood when I was very, very small, maybe 5, 6 years and all. So if there had been anyone who had been sick, I have seen that they will be putting the clothes in a rolling boiling water outside the courtyard, and then doing this washing in the hot water. And I used to ask them why they are doing like that. They used to think it's used to say it is to kill all the organisms. But yeah, this continuous stirring so that it will be uniformly spread, because the linen, they are not going to conduct the heat. They are poor conductors of it. So the frequent stirring is actually required. So boiling for about 30 minutes is adequate to disinfect linen, utensils, and also bedpans. Addition of 1 percentage of soap and 0.3 percentage of washing soda can enhance the effect of boiling. But boiling is also having some drawback. One, it is a slow process, unsuitable for thick beddings and also woolen material because they may shrink. And third one, it fixes albuminous stains. That is why when we told that if you are going to clean the linen with feces, pus, or blood, it should be first washed in the cold water. Because if we are directly going to use the warm water, the albuminous stains means the proteinaceous one. So all these things, the feces, the pus, or the sputum, the blood, everything is having some of the other nitrogenous waste or the protein things in it. So if we are going to directly put in the process for the boiling or using boiled water to clean it, the thing is it will result in the coagulation of that protein. So that stain, it becomes fixated. So it is better we first clean it with cold water, and then for the disinfection purpose we use the boiling process. So these are the three drawbacks of boiling. This is the industry level boilers. Then autoclaving, sterilizers. Notice the term autoclave. It's actually sterilizer, which is going to kill, not just disinfectant, going to kill even the spores. Sterilizers which operate at high temperature, which is in excess of 100 degrees Celsius, and high pressure are called as autoclaves. They generate steam under pressure, which is the most effective sterilizing agent. So over here, we have actually told that it should be the boiler should be above 100 degrees Celsius. Then only it can destroy the spores. But this is not achieved in boilers. But in case of autoclave, obviously it can go above 100 degrees Celsius. That is why even sterilization or the destruction of the spores is happening. So autoclaves fall into two categories. The two types are the gravity displacement autoclave and high speed pre-vacuum sterilizers. We don't have to go into the principles of how they are functioning. No, just the name will do. So basically the autoclave works on the same principle as the domestic pressure cooker. Autoclaving is widely used. So high temperature, high pressure, it will not, the pressure cooker, the Indian pressure cooker, what they mean is that, so we cover that pressure cooker like with a very tight lid, and then we cover, there is no possibility for the air to get inside. So when we are keeping it on the stove, because of the heat from down, the vapor will be formed, and this vapor is not getting evaporated. There is no way for the vapor to get evaporated. In between, we will be keeping something we called as a whistle. So when the vapor is too much, this whistle will be coming out like a piston, and a whistling voice will be coming, and then we immediately put again close. So a little air will be coming out, and it's a method that we use for cooking. So this whistle number is actually important. If you have seen the Indian pressure cookers, that also varies according to what we are going to cook. If it is rice, it will be depending upon the type of rice, 2 or 3 or 4 whistles may be enough. But if it is lentils, um, yeah, around 5, 6 may be required. But and if it is chickpeas, it should be more than 7 or 8. So there is the number of whistles that we have to take to get it proper cooked. So the principle is actually because of the temperature, the raised temperature, the pressure is forming, and the pressure is not allowed to go out. It is not getting evaporated until a large quantity is getting present over that, and then it will be opening up and slowly releasing, and that help in the cooking process very easy actually. So that's the same principle which is used in the autoclaving, high temperature, high pressure, and in that steaming, they are doing the process of sterilization. So autoclaving is widely used in hospital and lab practices. It destroys all forms of life, including spores. Absolute sterility can be obtained by raising the temperature to over 135. So in above 100, we told that it can kill the spores. But the absolute sterility, all the microorganism, the fungi, the what is the other thing, the virus, everything can be obtained by raising the temperature over 135 degrees Celsius. So this is the most effective method for sterilization of linen, dressings, gloves, syringes, certain instruments, and also culture medium. However, it is not suitable for sterilization of plastics, of course not, and also very sharp instruments. So these are the autoclaves. Now radiation. So we have some equipment which will allow the ionizing radiation, especially the gamma radiation, to do this disinfective process. So ionizing radiation is being increasingly used for sterilization of bandages, dressings, catgut, and surgical instruments. The objects to be sterilized are placed in plastic bags. Here we can keep the plastic bags because the temperature is not going to be raised. It's only the radiation that is coming out. So we can place it in plastic bags before radiation and they will remain sterile until opened. Ionizing radiation has great penetrating power with little or no heating effect. This method is most effective but is very costly. So not all the countries, only the highly industrialized countries could go for it. Commercial methods of sterilization are normally carried out by gamma radiation. This requires special packing and equipment. It is now one of the most viable, safe, and economic methods used today. They say economic, maybe once we purchase, we can use it for a long time. Maybe that is the meaning they're using economic. However, it is very expensive actually, but it is safe, of course. So this will be the ionizing radiation sterilization equipment. So you can see the instruments that has been used that is being used in the hospital kept for the sterilization. So that is the physical agents. We saw the natural agents, the sunlight and the air. We saw the physical agents, that is actually the boiling, burning, hot air oven, the ionizing radiations, all these things. Now we come towards the chemical agents. So here a lot of chemicals are going to come up. It's actually this section which I don't have to explain a lot. So articles which cannot be sterilized by boiling or autoclaving may be immersed in chemical disinfectant. Chemical agents may also be used for the disinfection of feces, urine, and other contaminated material. There are a wide range of chemical disinfectants, each with its advantage and disadvantage. So there are many types of chemical disinfectants, 10 types actually, and some of it are having further categories. So the first one is phenol or the phenyl that we use for our household purpose very commonly. Then there are quaternary ammonia compounds, then halogens. And the halogens, it mainly comes the chlorine, the alcohol formaldehyde or its liquid form formalin, oxidizing agents like permanganate, potassium permanganate, metals as microbiocides, especially uh, silver, then lime, ethylene oxide, miscellaneous inactivating agents. So we go through one by one. So starting with phenol. So phenol, the pure phenol or carbolic acid is the best non-member of this group. And this carbolic acid was used by our Lister, Joseph Lister, for disinfecting the wounds. He used this carbolic acid. On exposure to air, the colorless crystals of phenol, it become pinkish, and on longer exposure, it will become dark red. Pure phenol is not an effective disinfectant, but it had to be a little bit diluted. It is used as a standard to compare the germicidal activity of disinfectant. So pure phenol, the real one, it is not actually a permanent, like an effective one. It is more used as a standard level on which we can learn about the disinfecting ability of other chemicals. The second one, crude phenol. The phenol that is commonly used for disinfection is called as the crude phenol. So it is not the pure phenol that we are using for cleaning purpose. What we use is actually the crude phenol, and that is a mixture of phenol and also cresol. So that becomes the crude phenol, which we are using actually for the cleaning purpose. The pure phenol, we use it as a standard on which other disinfecting materials are compared. So this crude phenol, it is a dark oily liquid. It is effective against gram-positive and gram-negative bacteria, but very slowly effective against spores and acid-fast bacteria. Acid-fast bacteria, the two mycobacterium, Mycobacterium leprae and also Mycobacterium tuberculosis. So the one which causes leprosy and tuberculosis. It is also effective against certain viruses. Its effect is greatly weakened by dilution. Therefore, it should not be used in less than 10% strength for disinfection of pieces. In 5% strength, it may be used for mopping floors, and also for cleaning drains. Aqueous solution, which is very less, 0.2 to 1%, are bacteriostatic. So the higher percentage can kill the organisms, if not the spores, but if it is in a very low concentration, like 0.2 to 1%, it just inhibits the growth of the organism. That is, it acts as a bacteriostatic, the static one, not the killing one. So this is about the crude phenol, a mixture of phenol and also cresol. The third one is cresol. It's an excellent coal tar disinfectant. It is 3 to 10 times as powerful as phenol, yet not more toxic. It is less toxic. Cresol is best used in 5 to 10% strength for disinfection of feces and urine, and it is an all-purpose general disinfectant. Cresol emulsions. Cresol emulsified with soap is known as saponified cresol. So the example that we get in the market, different names, Lysol, Izal, Xylene, are all cresol emulsions. Lysol contains 50 to 60% of cresol. They're very powerful disinfectant. A 2% solution of cresol of Lysol may be used for disinfection of feces. So here the cresol emulsion, when it is mixed with actually soap, then a 2% solution is enough. But in cresol proper, when they used for the disinfection of feces, it was 5 to 10% strength. And the other one, the crude phenol, for the feces, it was 10% that was required. You understand the difference of the strength that is to be used. Can expect MCQ. And also, but more than that, because I don't like asking these numbers. And if I don't get any question at all, then only I will be going. Otherwise, I avoid such by hearting questions. But of course, the examples like the cresol, in which family it belongs to. So it is the phenol family. At least that you need to remember. And then underneath that one, so the cresol, and underneath the phenol itself, we are having the fifth one, the chlorhexidine or hibicane. This is one of the most useful skin antiseptic, soluble in water and alcohol, but it is inactivated by soap and detergents. So 0.5% solution, whether it is alcohol or aqueous solution, we can use it as effective hand lotions. Creams and lotions containing 1% chlorhexidine are recommended for burns and hand disinfection. This is chlorhexidine, antiseptic solution, which means we can use it on our living tissues. Then hexachlorophane, this antiseptic is highly active against gram-positive organisms. but less active against gram negative. It is slow in action but shows cumulative effect on the skin and is compatible with soaps. So this can be incorporated in soap preparation without the loss of activity. And we have the very common Dettol or chlorosilinol, which is relatively non-toxic antiseptic and can be used safely in high concentration. It is active against streptococci but worthless against some gram-negative bacteria. Dettol in 5% is suitable for disinfection of instruments and plastic equipment. A contact of at least 15 minutes will be required for disinfection. The second one is the ammonia compound. So the first one, all the cresol, the chlorhexidine, Dettol, everything, it belongs to the phenol family actually. So in the ammonia group, we have the cetrimide. It is manufactured under the term cetavlon. We have something, yeah, Savlon in India. I'm not sure whether it is available here. So this is something that is belonging to the ammonia family. It is actively bactericidal against the gram-positive organisms, but much less against the gram-negative organisms. Cetavlon is soluble in water, which is having a soapy feel, and it may be used in 1 to 2% strength. Savlon, it is a combination of cetavlon and also hibitane, the phenol. That has also been, phenol is this, hibitane is this one, I think, chlorhexidine. Yeah. So a mix of uh, cetavlon and also the hibitane that gives the savlon. The plastic appliances may be disinfected by keeping them in normal strength savlon for about 20 minutes. Clinical thermometers may be best disinfected in Savlon, 1 in 6 parts, 1 in 6 parts of spirit in just under 3 minutes. So this you can remember in future for your clinical practice also, and also for the questions. So clinical thermometer can be disinfected by Savlon, 1 in 6 parts of spirit in just under 3 minutes. And there's a okay, I can't explain much of these things because it's so technical, so theoretical. I can say you something related to Savlon. So in India, we had this Dettol, which is so uh, the first one or the first ranking antiseptic actually. So simple cut happened, the Dettol was used, and obviously you would be knowing Dettol. When we use it, it caused such a burning pain. The pain that is caused by the wound might be bearable, but the pain that is caused by the application of Dettol, that is unbearable actually. And when I was a child, my mom, in case some wound happened, she used to use directly. Directly, the Dettol will be taken in a cotton and that will be applied directly. If it is just mixed with some water, then that burning pain will not be there. But Indians, they used to have, because the advertisement was such in a way, or the people believe that it was the burning of that Dettol being used which is killing the organism or preventing the wound to become septic. So the burning is very much necessary. So that became the concept of the people. If you are using Dettol, if it is diluted, then there won't be any burning pain. Then this is not going to be antiseptic. So they have to be using it directly. And because, as I told you, because of this burning pain, that is unbearable than the actual wound pain. So Dettol we didn't want to use, but we were forced to use. But then, when I was around 10, 15 years, maybe 15, somewhere at that age, Savlon came up. And Savlon, even now it is the Savlon, but not as competitive against Dettol. So when Savlon came up, its advertisement was something similar like it won't cause that burning pain. So their marketing technique was that it is as effective as Dettol, but it is not going to cause any burning pain. So the advertisement was itself like that. So they wanted to compete Dettol because the only problem with Dettol was that burning pain. So even Savlon, if you are going to use directly also, it won't cause that burning. So for some time, the market said that the Savlon selling. It went for, I mean, it exceeded to the level of the Dettol for some time. But after that, Savlon market value began to reduce. And the thing was the same advertisement which they used to boost their selling, that itself became a negative for them in a longer run. So in the initial phase, people bought it because there was no burning pain. That was the advertisement. But then, as I told you, a larger population in India, they believe that it is that burning that is happening which is killing the organism. So when they started using Savlon, initially everyone, maybe the market was very good for Savlon. So at that time, maybe so many people bought it as an alternative for the Dettol. But when there was no burning coming up, many of the Indians, they started speculating. And I say you around my age of 15, so you can calculate the years back. It was around 95, 97 at that time. So at that time, when the internet is not that common or anything, people started to feel that when they are using Savlon, there is no burning pain at all. So they started to doubt its action because it is all about microorganisms. They are not able to see the microorganism whether it is dying or not. So they started doubting whether the Savlon is working because it is not producing any burning pain. And then its market uh, started to deplete. So the same thing, the thing which they boosted for their promotion, that it won't be causing any burning, that itself became a negative in a longer run. So that's just a market story I had to say. It is more related to the business technique or the market. If we our topic is that, but I just wanted to say because next slides are all so boring about some strength, some chemicals on what it can be used. I just told you something so that you are there hearing me. So Savlon, that's the story. Now we go to the third category, the halogens, in which the chlorine and iodine are the main components. So chlorine and chlorine compounds, they're very potent, bactericidal, fungicidal, sporicidal, tuberculosidal, even the tuberculosis, because in India tuberculosis is a big thing. So even specific for acid fast bacteria or the tuberculosis, mycobacterium tuberculosis, and virucidal also. Since long time, chlorine has been used as disinfectant in water treatment. We'll be learning it later in detail, the chlorine being used, especially the disinfection, etc. So bleaching powder or chlorinated lime, chemically CaOCl2, is a white amorphous powder with a pungent smell of chlorine. I'm sure you might have seen this bleaching powder. It's almost always present in every household. A good sample of bleaching powder contains about 33 percentage of available chlorine. This can be asked as a MCQ. A good sample of bleaching powder means 33 percentage of chlorine should be available. And what is the term available chlorine means? It is the chlorine, amount of chlorine that is actively available to disinfect a solution. So when we are using 100 gram of bleaching powder to a water body, imagine a well. So we are going to put 100 gram of chlorine, sorry, 100 gram of bleaching powder. In that 100 gram, we are going to get only 33 percentage of chlorine. Even that 33 percentage chlorine is enough. So that is how the calculation. So if it is 33 percentage chlorine that is available from 100 gram of chlorine or the bleaching powder, then we have to calculate. So for the whole well which is having liters of water, how much amount of bleaching powder should be add to disinfect. So that is for this calculation they use the term available chlorine. So when we say a good sample of bleaching powder, it should be having 33 percentage of available chlorine. It kills most of the organisms when used in the strength of 1 to 3 percentage. More of its detail, like how it is used or the strength it is used, That we'll be dealing when we are learning the next chapter. I think next chapter or somewhere the chapter water sanitation comes. At that time, we'll be seeing it more. The bleaching powder is widely used in public health practice, especially in LMIC, including India, for disinfection of water, feces, and urine, and also as a deodorant, especially in a street. Um, I have seen when people are cleaning a street. I told you about this mela that is happening. After that, because it is happening on the streets, it's not possible to use something very expensive to clean. So they use actually this bleaching powder, water, the water in which the bleaching powder in a particular quantity. After calculating the amount that is required, they will be putting it and then use that water for this disinfection purpose. Even when someone passes away and we remove that dead body, after that the house will be cleaned with this bleaching powder. So like that, we use that. The chief drawback of bleaching powder is that it is an unstable compound and loses its chlorine content on storage. Its action is rapid but brief. 5% solution is suitable for disinfection of feces and urine, allowing a period of 1 hour. So it should be made to stand for 1 hour with the 5% solution to get it disinfected. The second one under the chlorine is hypochlorites. So hypochlorites are the most widely used chlorine disinfectant which is available in liquid form. The other one, the bleaching powder, it's the solid form or the powder form it is available. But hypochlorite, we get it in the liquid form. So this can be, it can be available in the liquid form and also in the solid form. The liquid form is sodium hypochlorite and the solid form is actually calcium hypochlorite. And it is this calcium hypochlorite which um, Similways used for hand washing purpose actually. So 5.25 to 6.15 percentage of sodium hypochlorite, usually called as household bleach, is the most prevalent one. They have a broad spectrum of antimicrobial activity and they do not leave any toxic residues. But the protective residue may be there, but as we already told, it may be rapid but brief in action and are unaffected by water hardness, inexpensive and fast acting, remove dried or fixed organisms and also biofilms from surfaces. So these are the benefit of the hypochlorite when it is being used and especially this is used for disinfection of water. So that is why they told that even if the water is hard, now you may be remembering the water hardness, there will be soft water and hard water. Even the hard water it will be temporary and also there will be permanent hardness. It is because of the calcium and magnesium salts being present in it. We will come to it when we do the chapter on water. We'll be coming details about that. So when we use this hypochlorite, it is not affected by water hardness. Even why it is important, why they're saying that the main purpose of hypochlorite to be used is to disinfect water. And in case in some area when there is hard water that is present, then if you are going to use hypochlorite, the disinfection is not taking place. So that is why it is called that even the hypochlorite, it is not affected by water hardness. It is inexpensive also because if it is water disinfection and that is taking place in a public like the corporation, they are going to supply the water and then they are using the disinfection. If we have to use, they have to use it in a large quantity. So it shouldn't be expensive. It should be fast acting. Not that they use the chemical today to disinfect the water and the water is getting disinfected 2 or 3 days later only. It won't work like that. And also to remove the organisms, biofilms, etc. from the surfaces. Then chlorine tablets are there, which is actually small tablets that is available for a small scale disinfection, like to the use of in a household purpose, etc. So under various trade name, example halazon tablets, these are available in market and this is quite good in disinfecting small quantities of water. The earlier one which we told the calcium hypochlorite, the calcium chloride or the bleaching powder, uh, if it is for disinfection of water, it is used for a large quantity of water, like step wells, the well water, or the river water, etc. Uh, and hypochlorite may be for the tanks in a particular area of distributing water. The municipality or the corporation, they may be having water tanks. For that, hypochlorites may be used. But in a household level, if you want to use in a smaller, we can go for the chlorine tablets. Then iodine is also there, but not nowadays. It is not being that used unless it is that urgent or that emergency. Iodine solutions or tinctures are being used by health professionals primarily as antiseptic on skin since long time that we use iodine actually. It is bactericidal, fungicidal, virucidal, and lethal to spore-bearing organisms. Iodine is cheap, readily available, and quick in action. However, we are not using iodine unless it is very necessary in case of disinfecting water. One of the main reason is it is costly actually. They are saying it is cheap, but when compared to the chlorine, iodine is costly. And another thing is the excess of iodine consumption can result in thyroid complaints, the hyperthyroidism. So because of these two things, iodine is not used for disinfection water in a larger scale unless it is emergency, because it is very quick in action for an emergency purpose, like we get to know that a person is having cholera and then immediate control of the disease is required. So at that time iodine can be used in that area if there is a well that is present. This I'm saying about a small household area. I'm not sure about the Malaysian the how the water supply is coming over here. uh, but in a small area, like in a small village or something, where they are depending on wells for water, some rural villages in India. So over there, if there is a case of cholera, then immediately the water has to be disinfected. At that time, more than chlorine water, it is ideally to be used. So for those emergency conditions, we can use iodine, but not as a routine. For routine, it is better to go for the bleaching powder for disinfection of water. Okay. Then iodophos, it is a combination of iodine and a solubilizing agent. The best known is actually povidone iodine or the betadine. They are non-irritant and they do not stain the skin. Otherwise, iodine, it leaves a brownish stain. Besides the use as an antiseptic, iodophos have been used for disinfecting blood culture bottles and also medical equipment. Fourth is alcohol. Ethyl and isopropyl alcohols are commonly used as antiseptics and disinfectants. Ethyl alcohol, we know that we use the ethanol actually, sometimes as a sanitizer also, in the form of industrial methylated spirit, is the alcohol most commonly used for skin disinfection and also for hand washing. Pure alcohol has no powers of disinfection like our pure phenol, but when diluted with water to 60 to 90% volume per volume, it is a potent bactericidal, fungicidal, virucidal, and tuberculocidal, but does not destroy bacterial spores. Its activity decreases rapidly below 50% concentration. 70% alcohol is lethal in a period of seconds to all types of non-sporing bacteria. But however, when alcohol is being applied on the body, its action will be very momentary. It will be soon getting evaporated. So there is no residual activity that is being present while using it. We have to use it very frequently. Because of expense and also flammability, it should be used in hands kept in cool area. This one's alcohol's use as a disinfectant is limited to only small articles. And they also, as I already told, evaporate very rapidly, so no residual effect will be there. Fifth one will be formaldehyde. Mostly we use it in the solution form formalin. Formaldehyde is a highly toxic and highly irritant gas which precipitates and destroys protein. Of course, if you have smelled that formalin, you can't stay that. It is very, very irritant actually. It is effective against vegetative bacteria, fungi, and many viruses, but very slowly effective against bacterial spores. and also acid frost bacteria. It does not injure fabrics and metals. It may be used 2 to 3% solution for spraying the rooms, walls, and also furniture. But mind, because it will be very, very pungent and irritant. Formaldehyde gas is most commonly used for disinfection of rooms. The gas is most effective at high temperature and a relative humidity of 80 to 90%. The gas may also be used for disinfection of blankets, beds, books, and other valuable materials which cannot be boiled. Then oxidizing agents, potassium permanganate, hydrogen peroxide, parasitic acids are the main ones. So potassium permanganate, it is that purplish black crystalline powder, and it is going to color everything where we are going to use it, and hence it is not much used because of the coloration it is leaving behind. The use of potassium permanganate is very much limited. It is used to disinfect aquariums and is also widely used in community swimming pools, especially to disinfect one's feet before entering the pool. It is also used to disinfect fruits and vegetables. However, it is limited because of the color residue it leaves behind. Hydrogen peroxide, it is bactericidal, virucidal, sporicidal, and fungicidal. It is used in hospital setting to disinfect surfaces. A 0.5 percentage hydrogen peroxide demonstrated bactericidal and virucidal activity in 1 minute and mycobactericidal and fungicidal activity in 5 minutes. A 3% solution, which is more, can be used as an antiseptic for cleaning wounds and also discharging ulcers. And this is actually we use for cleaning and dressing in hospitals. Parasitic acid, it is a disinfectant produced by reacting hydrogen peroxide with acetic acid. It is broadly effective against microorganisms and is not deactivated by catalase and peroxidase, the enzymes that break down hydrogen peroxide. It inactivates gram-positive and gram-negative bacteria, fungi, and yeast in less than 5 minutes at less than 100 parts per million. For viruses, you see the amount, it's ranging from 12 to 2250 parts per million. So that much quantity parasitic acid is required in case it has to be acting against the viruses. Metals, the best non-metal will be actually the heavy metals, that is especially silver. So silver, it is used for prophylaxis of conjunctivitis, especially of the newborn, the ophthalmia neonatorum. We study that in our medicine, agenda nitricum also. It can be used for cleaning purpose, especially for the children when they have this ophthalmia neonatorum. And even not just our medicine AGNO3, but even for this antiseptic purpose, especially for the eye topical application. Even the allopath, that hospital, they use this argent and nitricum based solution. And also the silver is used for topical therapy for burn wounds and also bonding to indwelling catheters when catheters are left within the body. So for that disinfection purpose also this silver can be used. Also iron and copper for controlled disinfection of water or reusable medical devices. You can use iron or copper and other such heavy metals. Then lime, it is the cheapest of all disinfectants. It is used in the form of fresh quicklime or 10 to 20 percentage of aqueous suspension known as milk of lime. Feces and urine, very easily available, very cheap actually. Feces and urine can be disinfected by mixing milk of lime and allowing for a resting period of 2 hours. As slime wash, it is used for treating even the walls, especially in India, earlier, not nowadays. Nowadays, the paints are there, but earlier they used to have this slime wash. As a deodorant, lime that is being still used is sprinkled in cattle sheds and also stables and in public places where urinals and latrines are located. Very easily available and very cheap, and that is why it is being used so. Ethylene oxide, heat sensitive articles may be sterilized at 55 to 60 degrees Celsius by ethylene oxide gas, and this can kill bacteria, spores, and also viruses. It is very explosive in nature, so better to use in mixed with carbon dioxide. Water vapor is also often added to this mixture so that the efficiency increases. So this has been effectively used to sterilize fabrics, plastic equipment, cardiac catheters, books, etc. But the process is difficult to control because it is explosive in nature. So often, ethylene oxide is discouraged when other alternatives are available. Some miscellaneous inactivating agents or process. The first one is pasteurization, the microwave, and also flushing and washer disinfectors. So pasteurization, it is not a sterilization process. We know that all the organisms are not being killed. Its purpose is to destroy all pathogenic microorganisms. But suppose anything, if it is remaining, it is not being killed. The time temperature relation for hot water pasteurization is generally 70 degrees Celsius for 30 minutes. Microwave. Microwaves are used in medicine for disinfection of soft contact lenses, dental instruments, dentures, milk and urinary catheters for intermittent self-catheterization. However, microwaves must only be used with products that are compatible with flushing and washer disinfectors. Um, Flushing and washer disinfectors are automated and closed equipment that clean and disinfect objects from bedpans, urinals, and wash bowls to surgical instruments and anesthesia tubes. They have a short cycle of few minutes. They clean by flushing with warm water and possibly with a detergent, and then disinfect by flushing the items with hot water or with steam. So if we put into that these disinfectors, and then initially they will be flushing with the warm water and also the detergent, and then disinfect with hot water or with steam. Because this machine empties, cleans, and disinfects, manual cleaning is eliminated, fewer disposable items are needed, and fewer chemical germicides are used. But obviously, then it will be very expensive. Then ultraviolet radiation, which we already saw, like the radiation that is coming from the sun, we know that it is a natural agent. But then the ultraviolet radiation, usually the wavelength is 328 nanometer to 210 nanometer, but the maximum bactericidal effect occurs at 240 to 280 nanometer. And this can be used for disinfection of drinking water, air, titanium implants, and also contact lens. Bacteria and viruses are more easily killed by UV light than the bacterial spores. Then it is the ozone, which has been used for years as a drinking water disinfectant. Ozone is a powerful oxidant that destroys microorganisms, but it is highly unstable. And the half-life period is very less, that is only 22 minutes of room temperature. There is very less residual activity with ozone. It is very expensive, very effective. Momentary, it is a very good disinfectant, especially for water, but no residual activity. Then it is some disinfection procedures that we have to do, especially if it is feces and urine. So feces, urine, rooming, sputum, how we can disinfect that. So this just we are never like in a homeopathic. We don't have to do it, but maybe I thought of deleting this, but then I thought maybe in household, uh, our own family, we never know. So maybe it is useful at that time. And I'm very sure you're not going to open up this PPT at that time, but still, I thought I will keep. So for the disinfection of feces and urine, it should be collected in impervious vessels and disinfected by adding an equal volume of one of the disinfectant given in this chart, and allowed to stand for 1 to 2 hours. And if this disinfectant, which is listed, if these are not available, we can add an equal amount of quicklime, because I told you the quicklime is very much easily available, or freshly prepared milk of lime may be added, mixed and left for 2 hours. If nothing is available, all these whatever we told, even the quicklime is not available, then a bucket of boiling water may be added to the feces, which is then covered and allowed to stand until cool. After disinfection, the excreta matter may be emptied into water closet or buried in the ground. Bedpans and urinals should ideally be steam disinfected. Agents suitable for disinfection and feces of urine of disinfection of feces and urine are as following. So bleaching powder, crude phenol, cresol, or formalin, and the required amount. If it is sputum, this is best received in gauze or paper handkerchief and destroyed by burning. That is the most ideal way. But if the amount is very much, if it is in a household, okay, we can burn it. But if it is in a larger amount, like in a TB hospitals, it can be disinfected by boiling or autoclaving for 20 minutes. Alternatively, the patient may be asked to spit in a sputum cup half filled with 5% cresol, and this will be a example of concurrent disinfection where as soon as the person is discharging or eliminating that sputum, it is getting, and he's directly actually coughing up that sputum to a cup filled with 5% cresol. So disinfection is happening simultaneously. When the cup is full, it is allowed to stand for an hour and the contents may be emptied and disposed of. If it is a room, the ideal one, what we told was actually the cleaning, airing, and also sunning. For several hours will be sufficient. If necessary, floors and hard surfaces in the room should be prohibited for 48 hours. By then, almost all the microorganisms, especially the disease causing, uh, that will be getting eliminated. For chemical disinfection, floor and hard surface may be sprayed or mopped with the disinfectants, chlorinated lime, formaldehyde solution, phenolic disinfectants like Cresol. On rare occasions, we can use fumigation. The gas most commonly used is formaldehyde. The room is kept closed for 6 to 12 hours to allow disinfection. Formaldehyde disinfection is most effective at high temperature and a relative humidity of 80 to 90%. So that is with disinfection, the process, the many disinfectants, all the things. And this was kept for MQA purpose. Do you wish to do this? The 10 questions are there, I guess. Can we do or can we just stop? Whatever your wish, your choice.
Maybe we can do it ourselves and discuss next class.
Okay, but the answers are given in the later PPTs, okay?
Oh, okay.
So you shouldn't go into it. Answers are kept it separate, so you shouldn't go to it. Because it is for the MQA purpose I have kept. So I had to keep the answers also, but you can go through it. So I know this has been very boring. There is nothing much to explain in this. So can we conclude?
Okay. Then
Yes, Vinod.
recording. Recording.
Wait. Yeah, wait. Let us stop the recording.